can be the ideal, the setup which you were talking about? What is the kind of ideal, the distance, the kind of chair which can help people already with the problems, and for us who have not developed any problems yet?
Yeah, typically, Sumiran, that any working environment, whether you are working in an office or the home, the principles remain the same. The thing is that while you're working in the office, your employer is responsible for giving you a safe and ergonomic working environment. Now, the responsibility is falling on you when you are working from home. So typically, our homes are not architecturally designed in that way that you should have a separate room for, you can say that, working from home. And nowadays that culture is coming up. The new architectural designs of the home are taking care of the area where you can build a small work from home office kind of an environment. So typically right now, most of the people don't have that kind of a setup ready with their home. So you need first you need in a very good room, ventilated room, where you could have a sunlight, where you would be devoting your almost 7 to 8 hours minimum while you are working from home. So that setup needs to be done. I think most of the corporates are funding that work from home furnitures for that also. That's a good initiative most of the companies are taking. Typically that the thing that you have to take care of is a good desking solution, and a good seating solution, that what your body needs is. So on a desking side, I would not recommend you to be seated for 8 hours and doing your job. So a desking solution, if you that gives you a modularity where you can work while sitting, and that have a comfort of working within a standing position as well. So if your desking solution gives you that modularity, that is good enough. And for the seating solution, you can say that the chair that what you are sitting on, that needs to support your spine. Spine curve should be supported. That should have a lumbar support. Your seating height should be adjustable. You should have you can say that back seat lock arrangement with you, so that you should not you can recline while you are working on desk. You should try to sit on a 90 degrees. And a good chair should have a headrest, that should have a adjustable headrest, and should have an armrest with you can say that, so that you can put your forearms or the wrist or parallel to the floor, and that should have a cushion inbuilt. So these are the seating solutions that should look for while you are doing your continuous job. And the working desk or the monitor height, that should be adjusted to your eye level. Ideally, what is recommended is the monitor should have the top of a monitor and the bottom of a monitor should make an angle of 45 degrees to your eyes. That's roughly, you can say that upper edge should be at a level of your eyes. These are some basics that you should take care of.
Thank you, doctor. That was very informative. I think we might have to, since people are still joining, I think we should take it up towards the end of the session once again. So the next question can be, what is mom's shoulders and how can it be reversed?
I think I will take this question as a mom's orthopedic problem rather than a mom's shoulder, because I think you have specifically asked mom's shoulder. I think a mom, let me come to that first. After that, I will take other of the specifics orthopedic issues that moms are facing. The orthopedically, you can say that shoulder pain or the pain in the back of shoulder or on a shoulder tip. These are the typical pain that is happening post-pregnancy in the females. And they have been linked to typically the postures they are taking during breastfeeding. That's the number one thing. And typically the breastfeeding during night, and they take an abducted arm and take baby's head on the shoulder. That kind of a situation they take. So these typical postures lead to a shoulder issue. And the other thing is that the cause of the shoulder pain is typically moms take baby on a particular side only. Suppose that somebody is a right-handed, they will try to pick the baby on the left side. In the mom shoulder, the non-dominant sides usually get affected. So these are the typical shoulder-related issues that happened on the mom shoulder side. And I think during pregnancy, the hormonal level get up, and your body gets relaxed. Most of the ligaments are relaxed, and your flexibility increased during pregnancy time. That's a natural gift ladies get during the pregnancy. But once the pregnancy has been over, that hormones typically go on a decreasing trend. So the flexibility of the body started going down. So the females may have some of the stiffness issues that are related to that hormonal decrease that you can say. And typically for the resolving that the shoulder pain, I would recommend that most of the people would get relaxed only with the simple stretches that you recommend, simple upper spine exercises, neck exercises, or the shoulder shrugs. Or you can say that when you put your arms, you can say that you put your both the palms behind your head and try to stretch your elbows and take that behind, so that your shoulder blades are coming near to each other. So these are the stretches that can relieve these shoulder pains, and the shoulder shrugs that can also relieve the mom shoulder pain. And typically the neck exercises, the neck exercises set you can take that. You can say that taking chin down, chin up, ear to shoulder right, ear to shoulder left, then chin to shoulder right, chin to shoulder left, and then the rotation of the neck. These are the simple steps that can relieve the a mom shoulder pain. And typically the feeding on the alternate sides, and typically while you are sleeping on the bed, you can change your side from right to left also. That can also relieve that typical chronic strain on a one shoulder while you breastfed on a night time. I think these are the simple tips that can take care of mom shoulder.